Yep, there should be a continue button letting you know that. And this recording I will disseminate it, but it will only be good for 30 days, just as for your information. I'm going to pass on, before we get started, we're going to do a land acknowledgement, and I will let Nicole, my coworker, read the land acknowledgement.
Oh, thank you. Sorry, we would like to acknowledge the Dena'ina and all Alaska Natives on whose traditional lands we gather. We are grateful for the Dena'ina's past and present stewardship of the waters, plants, animals, and spiritual practices of this place.
Thank you, Nicole. So as we get started, if you have the ability to turn on your camera just for a brief moment so we can see everyone's faces who's attending today, that would be fabulous. And then please introduce yourself in the chat box, provide your name and the organization you work for. And just to go over a little, as you do that, I'll just go over a little bit what to expect after. I will send a link of the recording that will only be good for 30 days of this community of practice. Additionally, afterwards, we will have a short evaluation that we will post in at the end of the presentation. I also will email it to you. If you could take the time to fill that out, that would be really helpful. This way we can make our future presentations and discussions better. And next, I'll just pop up a little polling question so we can kind of get a better idea of what people know about clinical sustainability. So I'll have Nicole pop that up. And then just as a quick Zoom etiquette reminder, please keep yourself on mute when not asking a question, but please feel free to unmute yourself, ask questions and or post in the discussion, in the chat box, I mean, and one of us will read your question and or comment from the chat box. Let's see. I'll let the polling continue for a second. So I'll let the polling continue and I will introduce our team members. Sorry if you hear dogs barking. So we'll look at the polling. So it looks like most people are not very familiar with sustainability planning. And
hey, Lauren, can you show us the poll? I'm not seeing it. Oh,
sorry. Yep. Thank you. Here's the poll. And so it looks like greater portion are not familiar with sustainability. Some are somewhat familiar, and it looks like no one is specifically familiar with the clinical sustainability assessment tool. So thank you. That is good information. And now I will really quickly just introduce our team and our speaker. So this is our team. This community of practice is being supported by the Alaska Native Tribal Health Consortium Epicenter Colorectal Cancer Control Program team. Our program manager is Diana Redwood. Our office specialist is Nicole Kayana, and I'm Lauren Smeda, the program coordinator. The Colorectal Cancer Control Program is a five-year funded program by the Center for Disease Control and Prevention. The program focuses on increasing evidence-based interventions to improve colorectal cancer screening, including the use of client and provider reminders, provider assessment, and feedback, as well as reducing structural barriers and increasing the use of patient navigation and small media. Our overall goal is not only to increase CRC screening, but also to increase the sustainability. And just as a quick reminder, if you haven't already, please introduce yourself in the chat box with your name and organization. And now I'd like to introduce Kim. Kim Prewitt manages sustainability projects for the Center of Public Health Systems Science at Washington University in St. Louis. She facilitates workshops and webinars for public health clinical care and social service programs throughout the United States on how to assess and plan for sustainability. She also works with groups to administer the program sustainability assessment tool and the clinical sustainability assessment tool. Collects and analyzes data related to sustainability planning and assessment, and provides technical assistance and training for sustaintool.org. Thank you, Kim, for giving this presentation, and I now give it over to you.
Thank you, Lauren, so much for the introduction, and thank you all for being here to listen today. I have to say, I was pretty excited to see that this is new content for this group. I love that. So, and that being said, I know that Lauren talked about staying muted, but if I'm going through this and any questions pop up, feel free to put them in the chat or even just unmute and stop me and ask a question. It's not going to bother me at all. I'd be happy to answer it. But let me make sure, can you all see the correct screen? Can you see my slide?
We see it, thanks.
Yep, thanks.
All right, thank you. Okay. So today I wanted to talk with you all about clinical sustainability. We want to define it. We want to talk about all of those factors that influence clinical sustainability capacity. I'm going to share a little bit about how to use the clinical sustainability assessment tool, or I'll call it the CSAT as well. And then share a little bit more about how to use that tool for sustainability planning. Oh, and these are the polling questions that we already did, so I'm moving on. So just starting out, I want to clarify a couple of terms that we use. Sustainability we think of as the ability to maintain programming and its benefits over time. But the other word that we use a lot, or you may hear often, is sustainment. And that we use when we're thinking about a program or policy that has been sustained. So just clarifying that a little bit. And now, why is clinical sustainability specifically important, right? Without sustaining effective practices over time, we really risk not being able to see the full return on our investment in public health or clinical care programming. And to maintain those benefits to the public, programs and practices need to be supported in lots of different ways. With knowledge of what those critical factors are, stakeholders can build capacity for sustainability of a program and really position their efforts for a long-term success. So sustainable implementation, it really helps ensure maximal benefit of evidence-based interventions for the long term. And it's critical for cancer control. Cancer will continue to be a public health issue, and sustainable implementation really ensures the best use of investments in a resource-limited setting. All that being said, sustainability is still the least studied aspect of implementing a clinical care intervention. And 40 to 60% of programs only sustain one or more element of their practice after a year of implementation. So lots of time and resources go into implementation, and all that, pardon me, all that could be lost if that intervention isn't sustained. So in response to the need for a clinical specific tool, we developed a sustainability framework that is focused on the specific challenges of sustaining evidence-based practices in clinical settings. We came to define clinical sustainability as the ability of an organization to maintain structured clinical care practices over time and to evolve and adapt these practices in response to new information. And the clinical sustainability framework identifies 7 key domains that can help build sustainability capacity in clinical settings. So the first one is engaged leadership and staff. And that is having a supportive frontline staff and management within the organization. So clinical practices depend on leadership and staff to carry out activities consistently and accomplish long-term goals. Practices are more likely to maintain an engaged team when they're based in collaborative environments that cultivate champions and motivate employees. Leadership can show that a practice is valued and promote a unified vision. Next is engage stakeholders, or having external support and engagement for the clinical practice. This can include patients and families, decision makers, researchers, other clinical teams, community members, or health board members. Having a diverse group of stakeholders invested in a practice can provide a foundation to draw on for additional support, expertise, and insight to overcome challenges and increase a practice's overall sustainability capacity. Next is organizational readiness, or having the internal support and resources that are needed to effectively manage the practice. The right organizational environment can help clinical teams develop and apply skills to carry out a practice effectively. Such an environment encompasses a range of organizational systems, policies, and resources that support practice activities and goals. So for example, achieving organizational readiness might involve updating the electronic health record, securing funding, training staff, or even cultivating a practice culture that's open to innovation and learning. Now, workflow integration refers to designing the practice to fit into existing processes, policies, and technologies. A clinical practice is more likely to become routine and sustain if it fits well within the policies, procedures, and infrastructure that's already in place. Next is implementation and training. So promoting processes and learning that guide the direction, goals, and strategies of the practice. Providing ongoing training and coaching, clearly defining goals and responsibilities, incorporating stakeholder feedback, and emphasizing a learning environment are all ways to promote ongoing quality improvement and help ensure adherence to best practices over the long term. Next is monitoring and evaluation, which is assessing the practice to inform planning and document results. Now, by documenting and discussing results, clinical teams can respond to weaknesses, they can adjust activities as needed, and celebrate successes to both improve outcomes and maintain staff engagement. Routine monitoring and evaluation allows practitioners to use ongoing feedback to guide and improve their activities. And finally, we have outcomes and effectiveness. So understanding and measuring practice outcomes and impact. A practice's benefits can help explain the investment needed to sustain it over the long term. Staff, leadership, and stakeholders are more likely to support and direct resources to a practice with clear benefits. Understanding the impact of a practice and communicating its outcomes to stakeholders is important for sustainability. Okay, so now that you've heard about those different domains, you want to bring up or are you able to bring up the third polling question? Or do I need to stop sharing to do that?
Oh, here, I can pull it up right now. See. There you go.
Thank you. So yeah, I'm wondering just what you all think the most important factor for sustaining your program would be.
Can anyone see that? Oh, there we go. Okay.
I can see it. Although it's hard to decide, frankly, which one is the most important. So,
sorry.
Yeah, it is hard to pick, especially when I just went through them so quickly. When we work with groups, we go through a process to help decide. I'm just curious to hear like what folks think is maybe most important. Is that it? I think that's probably everyone.
Can you share it?
Sure. Share results.
I'm always just curious.
Yeah, so it looks like engaged staff and leadership is the one that people find really important, which makes a lot of sense. It impacts so many different things. Even so many different domains are touched from engaged staff and leadership. So that does make a lot of sense to me. I'm going to stop sharing the results. And keep moving forward. Okay. You guys can still see my screen, right?
Right.
Okay, great. Sorry. So now we're going to move on to talking more about assessing sustainability. Now that we've learned about the different domains in the framework, from that framework, we developed an assessment tool. So the development process for that really looked like a literature review, a concept mapping process, and then expert input. And what we ended up with when we were developing that tool was 5 items for each of those 7 domains. So it's 35 questions total, and the respondents indicate the extent to which a practice has or does each thing on a 1 through 7 scale. So when we piloted this, we used it in lots of different settings. We had different professions and different roles, and even adult and pediatric care. And what we ended up learning was that the usability is good. There was a good participant reaction. Most folks agreed that it was easy to use and that people could learn to use it very quickly. But the most important thing that we were interested in was that it has high reliability and good initial validity. So it means it's measuring what it's supposed to measure. The tool only took about 10 to 15 minutes to complete. You can do it individually or as a group. And we did make that tool freely available on sustaintool.org. So if you are thinking about taking the CSAT to assess a clinical practice, there is an important term that you really need to define before completing the assessment. The word practice is in almost every question, and it refers to the set of formal organized activities that you want to sustain over time. And those activities could occur in a variety of clinical settings. For this group, today, I think the practice would be your colorectal cancer control program. If you are involved in other clinical care interventions, you would just substitute that in for the word practice. The important thing is that you want to make sure that everyone taking the assessment understands what you're wanting to assess. So through that sustaintool.org website, anyone is able to take an individual assessment, or you could set up a group assessment for up to 12 people to assess a clinical practice. We actually encourage group assessments whenever it's possible. So we really think it's ideal to have people from multiple levels within the organization or program, and maybe even some external stakeholders to complete the assessment. Getting multiple perspectives provides a more comprehensive view of sustainability capacity, and it's a great way to lead a sustainability discussion that can also inform program planning. I'm just going to say it one more time, but remember, if you're completing the CSAT as a group, it is important to check with the rest of your group and make sure everyone is on the same page and clear about what they are assessing. Now, the assessment questions are the same, whether you take it as a group or an individual. It's a user-friendly assessment, and like I said, it only takes about 10 minutes to complete. And you'll answer questions that address each one of those sustainability domains that we talked about. If you are doing a group assessment, It is easy to set up for your team. You will actually just need email addresses, and each person that you invite will receive an email from admin@sustaintool.org. And each email invite has a unique individualized link to take their assessment. So that means that invitees won't be able to forward their link to someone else. But that is how we keep those answers anonymous. So each person's response, even if it's for a group assessment, their own individual responses are anonymous. So when you're completing assessment on the website, you'll just choose the number that best aligns with each statement about your program. So there's 35 statements altogether that take you through the 7 sustainability domains. And as you see here, it's on a 1 through 7 scale. 1 meaning that your program has or does something to no extent, and 7 meaning that your program has or does something to the full extent. It's worth noting here that if someone doesn't know the answer to one of the questions, they can always click that NA on the right side, which that stands for not able to assess. So we really encourage folks to answer as best they can, but there may be aspects of the 7 domains that not everyone is familiar with, and that's okay. And that's why you have the NA option. So if you get part of the way through and you want to save your assessment and complete it later, all you have to do is click save and continue later. But when you are finished, it's really important that you record your answers by clicking that orange submit button. If you don't either save to continue later or submit, then it won't save your answers. So after you finish your assessment, you will immediately be presented with your sustainability profile, which is a summary of your individual results and your individual sustainability report, which you see here on the left. The report will give you your average sustainability score, and it will also break down your answers by domain and item. So you can really see your program's strengths and opportunities for improvement. This report is also saved into your account on the website, so you'll be able to access it at a later date as well. If you're doing a group report, a group assessment, then once everyone has participated and completed their individual assessment, you can generate a group report like you see here on the right side, and it shows everyone's scores combined. It shows both the average score and the range of scores for each domain. And the reports can really allow you to compare your program's current capacity across those 7 domains. You should definitely keep in mind that no program is perfect. Your group might have some low scores on some items, and that is expected and that is okay. Low scores do not mean that something is unsustainable, and high scores don't guarantee sustainability. The assessment is a tool. The numbers are a way for you to conceptualize your program across the domains relative to each other, so that you can start thinking about how you might want to use your strengths to build on some weaknesses. And these reports can help in sustainability planning. So because groups were interested in having some guidance about what to do with their sustainability assessment results, we developed a 3-step planning process. It's designed to help programs systematically explore all of those elements that contribute to sustainability, and then systematically plan to build in the areas that will give you the most benefit over time. The first step of the planning process is building your understanding of the factors that impact sustainability, which is what we've been doing a little of today by reviewing the framework and the domains. If you're interested in learning more, there's more information on the website as well. The next step in the process is to assess your program's current sustainability capacity by completing the CSAT. And then the final step is to use your assessment results to create a sustainability action plan that is focused on increasing your capacity for sustainability in a chosen domain. Now, I'm not going to take too much time today to walk through our entire planning process. I just want to highlight a few points that you can keep in mind for your program's sustainability planning. And your approach may not look just like ours, but hopefully some of these takeaways will be useful for your efforts. And then just another reminder, if you're looking for any additional information or resources for any of these 3 steps of the process, they're available on the website as well. So, oh, I'm sorry about that blurry picture. When you're thinking about sustainability with an actionable plan in mind, it's really helpful to think about which domains you have the most control over improving. It's really up to you to determine the domain that you want to focus your efforts on to get the most impact for your program, because each program is different in their needs and their capacity for bringing about change. So we typically advise programs to not necessarily choose your lowest scoring domains. We really encourage groups to choose domains that are most important to your program or practice, and also most feasible for you to make a change in. And all of those domains are actually interconnected. And so that means that working to improve in one domain should have a spillover effect and improve in other domains as well. So for example, a clinical team may plan a practice to use electronic health record technology that's already in place to guide performance. And that makes it easier to record and access your data and adjust activities as needed, which can improve outcomes and effectiveness. So when you're ready to develop a plan, if that is something that you choose to do, there are some key components that we recommend groups incorporate into their sustainability plan. We really encourage groups to choose one domain to focus on, like workflow integration or monitoring and evaluation. This focus then guides the development of a SMART objective. So you guys are probably familiar with the concept of creating SMART objectives, specific, measurable, attainable, relevant, and time specific. But your SMART objective can then guide your plan development and make the plan actionable. You'll break it down further into steps that are specific actions that you will take to reach your objective. And for each step, we also recommend including who's responsible for seeing that the work gets done, any non-financial resources that might be needed for that step, how you will know when you have succeeded, and a due date. And so this is just a sample plan that our team developed. And it's actually just a snapshot of a sample plan. It was actually much longer, but this is all that will fit on the screen. The reason that we bring this up or show it is because we think it's important to note the level of detail here. So each step also has bullets or sub-steps. The plan should really be written so that anyone can pick it up, understand it, see how much is complete, and where to start working. We have more action planning samples and templates on the website as well. We also have blank plan templates that look like this that you could use, but it is definitely not the only approach to developing a plan. So if you are interested in any additional information, the website actually has both of our tools, the clinical sustainability assessment tool that we've been talking about today, as well as the program sustainability assessment tool, which has been around much longer. We developed that in partnership with CDC years and years ago. I feel like we've had that on the website for probably about 10 years now. I can't hardly believe that, but yeah, depending on the work that you do and really where it is, you may decide that one of these tools is a better fit than the other. I think for the colorectal cancer control work that you're doing, the CSAT is probably a great fit. But if anyone is involved in something else, PSAT may also be an option. And we do have a lot of time, but I wonder if we have a lot of time for questions and discussion. So I can stop sharing and just kind of open it up for any questions that folks might have.
And as a reminder, please go ahead and unmute yourself, or you can write in the chat box.
I have a question. Can you walk us through an example of how an organization has used this process to improve their sustainability?
Oh, yeah, absolutely. So like I said, we actually have a partnership with CDC that's gone back for quite some time. But we actually worked with a group out of Colorado who is doing colorectal cancer screening program and specifically working with patient navigators. And they reached out to us right when we were first developing the CSAT. And so we actually have been through the entire process with that program. So we shared information about the tool, had each group take the tool. So for them, each group was a clinic site that had patient navigation services for colorectal cancer screening. So each group took the assessment and then talked through their results as a team and decided where they wanted to focus their efforts based on those results, built a plan, and over the last year have actually been working to implement that plan. While every group is working in patient navigation for the same services, their plans all looked very different from each other, which was actually great because every program and every location is so different. But we just last month had a meeting with those groups and brought them all back together. They took the assessment again and got to see, how their scores have changed and talk about their progress on their plans. And what was really helpful to hear was kind of the stories that they shared, not so much the numbers on the assessment and if they went up or not, but just how focusing on sustainability had impacted different pieces of that program and how they were able to continue to providing services even in a pandemic.
Hey, Kim, my name's Judy Llewellyn. Am I echoing?
You sound good to me.
Okay. I had a few questions. We partner with several different clinics and working on the colorectal cancer screening project. And I think you may have answered a couple of them, but this is our first year and we're just starting this process. And I'm just wondering, at what point would you want to do this CSAT? Do you, after you've really implemented it and started it, or, we're planning, we're learning. I don't think any of our clinics has actually implemented anything yet. So what would you suggest? At what point?
Yeah, that is such a good question. And the truth is we've actually had groups that have used this tool in two different ways. So I think the answer, while it might not be what you want to hear, but it's going to be what you think is going to work best for your program, because we certainly have had groups that take it during that planning stage to see like where they are and where their strengths lie, so that they can be thinking about things that they want to focus on as they implement up, like from the very beginning.
Okay.
And for those groups, they they take it at the beginning and think through how they want to incorporate it, but then they'll take it again. So like multiple time points throughout the program, just to check in and see how you're doing and make any changes or updates to the sustainability planning for the program.
That was one of my other questions was, can you retake this through the process? And so that, thank you. On the difference between the individual and the group, can they take all of the individuals and make that into a group results, or?
Yeah, so actually it's when you want to have a group take the assessment, each person will complete an individual assessment. And then as they've all completed, you just hit a close this assessment button, and the website will automatically those scores, and they will generate that group report for you. Okay. So each person will get their individual scores back, but whoever sets up the group assessment will get the group score back that they can share with the rest of the team.
Thank you. Thank you.
Yeah.
Appreciate it.
Great questions. Anybody?
Okay, I'm going to jump in with another question then. So this seems like something that would be very helpful. I know when we did a previous program, we had, I'll just admit mistakes. We didn't talk about sustainability till the 5th year of a 5-year project, which I know isn't when you want to be doing it, which is why we want to start it this time, like right from the start in year 1 for the current cycle. And overall, I really like this framework. I like thinking about the different domains, although they went by really fast, so you might have to show them to us again. But so it seems like something that would be very helpful and doing the project. But clinical teams are very busy doing the program. Even just getting people screened is challenging. What do you find that helps teams get inspired to use the tool? How have different organizations or teams done it so that they start using it and using it in their work?
Yeah, no, that is great. And you were right. People are busy. And that's the thing that we noticed when we did start the clinical tool, that they have so much less time than anyone else we've ever tried to get to take an assessment. And for us, getting folks to participate during the pilot and other groups that we've worked with, it's really been sort of bringing them on board with sharing information. So just from the beginning to say, before you even get the assessment or invite them to take it, to let folks know why it's important to you that they take it, why it's important for the program, and also let them know that, we don't plan on taking up too much of your time with it. It's actually going to be very quick. But sharing that information on the front end is usually a way to get people at least invested or at least willing to participate. Yeah, I think that's probably been the best. I will say this though, our initial feedback from this tool was, can you make it even shorter? And so truthfully, that is actually something that our team is working on right now. So we may be able to, we already did develop a shorter version of this tool, but we're testing it right now. And actually the reliability is still pretty good. So that may be something that is coming also to our website. So instead of having 5 questions for each one of those domains, it would only be 3. So then it's a total of 21 questions, and it would go a little bit faster.
Wonderful, thank you. And we do have a question in the chat from Becky Lawson. Is there a cost for this program? If so, how much?
So Becky, everything that we've talked about today is available for free on our website. So the information, the assessment, taking it yourself or taking it as a group. And then there are planning resources that we share on the website as well. The only thing that would cost is if you wanted someone from our team to come and sort of facilitate that conversation afterwards and sort of help build out the plan with your group. But you actually will have all the tools available to you for free on the website.
Thank you so much, Kim. Does anyone else have any questions or comments?
I mean, do you think it would be helpful at all to sort of walk you through the website a little bit and kind of show how easy it is?
I think
Yeah, could you show what kind of questions are asked? Like, is it something that people have to go digging in their medical record to find the information from, or pull in, their IT specialists? Like, what kind of things, what kind of work is involved in figuring this stuff out?
Yes, it is not that tricky. Let me just share this screen. Okay. And if this changes as I click on this or make something wonky, just shout out and let me know. Oh, you probably can't see the same. Okay, can you guys see that? Can you see?
Yeah, that looks good.
Okay. So yeah, sustaintool.org, which is what we've sort of been sharing as the link to the website, will take you to this homepage. We just click on Access CSAT, and these orange dots give you additional information. If you already know what you want to do, all you have to click is Get Started. If you wanted to check things out in advance or learn a little bit more, you click on Understand, and that will take you to just a little bit more information about this framework and tool. And also it gives information about each one of those domains. So you're able to scroll down through them, or you can just click on one if you're looking for information about a very specific one. So that is the Understand page. Go to the Assess page. Like I said, you can just jump in and go ahead and take it, or you can get additional information. Oh, I forgot to mention the CSAT is now available. And of course, frequently asked questions. But if you're ready to take the assessment, it's just this easy. So again, gives you a little bit of information before you take it, reminding you that you need to decide what your practice is. Sharing the organization and how it encompasses parent organizations or wherever the practice is being housed. It's just to let you know what some of the terms are that you're going to see in the tool and make sure that it's all very clear. For this, I'm going to say we're just doing a test assessment. And the name of the organization will be Test Clinic. And then how long has the practice been implemented? 1 to 2 years. You won't actually see this other information. It's because I'm an admin, so I have some extra buttons, but mostly it's just that easy. So now we're started. And then, how we define clinical capacity, why it's important, and what this tool is here for. And then it takes you right into completing the assessment. And again, for engaged staff and leadership, which is what you all thought was pretty important for your clinical practice, the questions here are things like the practice engages leadership and staff throughout the process. I would say, yeah, to a great extent. Clinical champions of the practice are recognized and respected. Yes, definitely. The practice has engaged ongoing champions. The practice has a leadership team that's made of multi-professional partnerships. Maybe not. And the practice has team-based collaboration and infrastructure. Okay. And then next, I mean, it just walks you through the assessment. It is very simple. I know you don't want to go through the entire assessment with me that way. So instead, I'm going to take you to will take me to the results. So I have access to that PDF report that I showed you. And this is just, it just stays in your account. So if it is something that you decide to take yearly or multiple times or to assess different programs, you'll have access to each one of those assessments. It's going to go away. You won't lose that information. Down here is group assessments, and this might be helpful if you plan on taking a group assessment. It is as easy as starting things the way that we did initially with the individual. But if it's a group assessment, it will have you manage your invites. So it takes you to this page that tells you you can invite people to take the assessment. And all that you need to have is your recipient's email address. You will enter it into one of these lines, up to 12. And then if you scroll down, there's, this is the email that they will receive when you send it out. But you can modify it any way that you want to. So you can send your own message to each person. You can change your message to your team, you know, address individual people, sign it with your name. All of this stuff is modifiable. And then when you decide to send it out, you can either send it to, you can either, you know, select one person to send it to and hit send selected, or just hit send all and it'll send all of your invites at the same time to your team. And I will mention, if you want to send a reminder to folks and half of your team has taken the assessment and the other half hasn't, you can still select send all and it will not bother anyone that's completed their assessment. They won't get that reminder. Okay, I'm going to stop sharing again. And just in case there's any questions about the website or things like that, I just wanted to share so you could kind of see how easy it is to navigate and to actually set up those assessments.
Thank you, Kim. That was super helpful. Does anyone have any additional questions or comments? I will have Nicole will post our evaluation link in the chat. So if you could please take some time to fill that out really quick, I will also email that to you. And if anyone wants to share this recording, I will be sharing the recording link shortly. And just as a reminder, it will expire in 30 days.
Get it out quick to everyone you know.
So the red cap link for the evaluation is in the chat box now. So if anyone has any additional questions or comments to Kim, just feel free to unmute yourself or type in the chat box.
I'm just going to share out my my email address in case, I mean, like, of course you can contact me through the website, but if anybody does come up with any questions or would like any kind of help taking the assessment or administering it to a group or anything like that, feel free to reach out if you have any questions. I'm happy to answer.
Well, thank you so much, Kim. Thanks for going over all of that with us, and really appreciate your time. It looks like this is wrapping up things. So I just want to say thank you so much for taking the time to give us this presentation. And hopefully we'll see you again soon.
Yeah, well, thank you all too for having me and for your thoughtful questions. This was a really great group, and I appreciate being able to speak with you today. So thank you.
Thank you.
Great. Bye, everyone. Thank you for attending.
Bye. Bye.
Take care. Bye.
Stop share.